Hello, biologists. So let's continue our discussion of our circulatory system. Let's turn to our capillaries and our arteries and our veins. So all of these vessels, this side is an artery, then here's some capillaries, this is a capillary bed, and then this is a vein. All of these contain a central lumen. Lumen means that space inside. That space inside is where that blood is going to flow. And then around that space is an epithelial layer. That epithelial layer is called an endothelium. So that's made of epithelial cells. And one result of having this epithelial layer, this endothelium, is that it's very smooth. So blood cells are able to just slide right past it. There's not a lot of friction. It helps minimize any resistance. So blood keeps flowing in the direction it needs to go. As we're looking at our arteries and our veins and our capillaries are really narrow. See how tiny they are compared to the width of this and then this one? It's only slightly wider than a red blood cell. So that is going to slow down the flow of blood. See here how we can see these red blood cells? They almost become single file trying to go through this narrow capillary, which that slowing down helps allow enough time for diffusion of nutrients to leave the capillary and for waste to be picked up. In addition, capillaries have very thin walls. They're really only made of the endothelium plus a basal lamina, and so it's a little bit leaky, which makes it able to have that exchange of materials between what is in the lumen of the capillary and what is in that interstitial fluid in the cells around. Arteries and veins both have this endothelium, but they also have a layer of smooth muscle. Kind of looks like this sponginess here, that smooth muscle, and connective tissue. So that smooth muscle is going to be involuntary in its movement to keep that blood flowing, even when you don't have to consciously think about it. You can see that they both are similar in that they both have these three types of tissues in them. But you can also see arteries are thicker, and you can see this width of this connective tissue is about 3 times larger than what it is here in a vein. So arteries have very thick elastic walls. So as blood is being pumped out of the heart, it's coming out of that aorta with a very strong pulse coming into the arteries. And so they have that very thick elastic wall that helps manage that high pressure of the blood from the heart. It's very elastic, so it's able to kind of stretch a little bit as the pressure pushes it, but also able to recoil back so that it exerts pressure against the blood to maintain that flow of blood. Blood pressure is also impacted by your hormones and nervous system, which can regulate the diameter of the blood vessels, allow that vessel to either open up to create a larger lumen or to constrict to have a slower lumen, which will also control blood pressure. If you think of like playing with the hose, if you were ever a kid who on a hot summer day went outside and played with the hose, if you turned on the water to your hose and the hose didn't have any attachment on it, water would kind of drool out of it. But if you cover half of that hose with your finger, water would shoot out a lot faster. That's just how the pressure of the water moves through it. It's the same thing with our vessels. As the lumen has a greater diameter, the blood is going to have a lower pressure, and as the diameter starts to constrict, the blood pressure will go up. Veins, you can see they have this thinner wall, and they also have a valve here. That's different from what we see over here. So there's a lot less blood pressure in our vein. They've come a lot further. Blood has traveled a lot further from the heart, gone through the capillaries before it's gotten to the vein. A lot of that blood pressure has been dissipated by now. So they don't need that strength of their connective tissue, but they do have these valves to maintain the flow of blood in the correct direction. It's going to take it back to the heart and not allow it to come backwards in the wrong direction. So let's look at how this concept of diameter of your vessels impacts things like the area, the velocity, and the pressure. So as your blood starts moving away from the heart, pressure drops. That's part of what makes it possible for blood to flow. Liquids flow from high pressure to low pressure. So coming out of the aorta, we've got a lot of pressure. You can see systolic, which is the pressure during systole, and diastolic, the pressure during diastole. So again, systolic is when your ventricle is constricting, pushing the blood. Diastole is when that ventricle has relaxed. So you can see it coming from the aorta, out of the heart, into the arteries, to the arterioles, the capillaries, then the venules and the veins. So we have very low pressure here. Also talking about the area of the lumen. So here you have one wide artery. So you have a little bit of area. And then even though each individual vessel is getting smaller and smaller in diameter, you're getting a lot more of them. So you're going from maybe 1 to 20 to 100 to even thousands. So when you add it all up, even though each capillary has a very small area, add it all up, all of those capillaries have a very large area. So you're actually increasing the surface area by the time you get to the capillaries. And by increasing that area, you are decreasing the velocity. So we see the heart moving, or the blood is moving most quickly through the arteries, and then it slows down when it gets to those capillaries, and then maintains a little bit of flow through the veins. Let's see. That speed, that slowing down is necessary for exchange of materials, for the blood in the capillaries to release oxygen and nutrients, for the blood to pick up waste products like carbon dioxide. And you can feel this systolic pressure and diastolic pressure if you ever measure your pulse. So put your fingers against your wrist or against your neck where you can feel your pulse. That pulse is that rhythmic bulging of the artery walls every time your heart is beating. So what is pulse measuring? A, blood pressure, B, stroke volume, C, cardiac output, D, heart rate, or E, breathing rate. So blood pressure is exerted in all directions, including against the vessel walls. When the ventricle constricts, it pushes the blood in all directions. There are valves that make sure it's moving in the right direction, but it's going to push against those arterial walls. And then the arterial walls are going to push back. And that's going to help maintain some of your blood pressure. By the time you get to capillaries, there's more resistance to blood flow as they're very narrow. And so that just dissipates a lot of the pressure. And then we just define these two words, discussing them in the last slide. But systolic pressure is the pressure in arteries during systole. Diastolic pressure is the pressure in the arteries during diastole, and is lower than systolic pressure because that's when the ventricle is relaxed. Okay, what is the primary cause of the low velocity of blood flow through capillaries? What causes blood to flow so slowly through capillaries? We mentioned these factors since almost probably the first slide of this video. So make sure you're comfortable with those causes. There's also other ways to regulate blood pressure, homeostatic mechanisms that can alter the diameter of the vessels. So here, this is what the artery is normally. It says vasoconstriction. See how this lumen has shrunk down? That's constricted. And then vasodilation. Dilation means opened up. So see how there's a lot more space? So here, there's going to be a lot more blood pressure because that blood is going to have to move a lot harder. So vasoconstriction narrows the arterial walls and increases blood pressure. In vasodilation, there's a lot more room for the blood to just kind of relax a little bit. So vasodilation increases the vessel, the diameter, but causes blood pressure to fall. Both of these have things that can affect that. So vasoconstriction might happen when you're startled and you feel your heart start beating faster, during times of stress. And these are both coupled to changes in cardiac output that can affect blood pressure. So how much blood you're moving through also will affect how much blood pressure, what your blood pressure is. We generally measure blood pressure for an artery in the arm at the same height as the heart. So they may, if you have a nurse come and take your blood pressure, it may be here at heart level, or they may put it on your wrist and tell you to hold your wrist up by your heart. But that is usually to counterbalance the effects of gravity, which have a big effect on blood pressure. Things like to, move toward gravity pulls things down. So that will pull blood to your feet if you're standing up, away, so we keep our blood pressure measurements at heart level. For a healthy 20-year-old human, so you all are most likely, most of you are within a few years of being 20. You're probably somewhere between 18 and 30, as if you're at Northeast. For a healthy 20-year-old human, blood pressure is normally 120 millimeters of mercury at systole and 70 millimeters of mercury at diastole. So you would be told your blood pressure was 120/70. That is a healthy blood pressure for a 20-year-old at rest. Fainting is caused by inadequate blood flow to the head. So maybe you are laying down for a while. There's, blood is moving around your body without much gravity. Then you stand up. Blood flows away from your head because now it's higher, and you faint. When you faint, that brings your head back down, which restores blood, which allows you to come back to consciousness. Animals with long necks, so like a giraffe, are going to have a very high systolic pressure to be able to pump blood that big distance against gravity. Because there's blood pressure that is very low in the veins, there is those valves that, close to prevent backflow of blood. So it opens here as it's being pushed from the back, but it closes to prevent it from coming back. Then blood flow returning to the heart is also enhanced by contraction of smooth muscle in the venual walls and skeletal muscle contraction too. So something like if you're running and exercising, that is going to increase your heart, increase your blood pressure in addition to increasing your heart rate. So if you've been exercising a lot, you probably need to make sure that you take a cool down period. You don't just go run a 5-mile marathon and then lay down in bed. You're going to run a 5-mile marathon and then slow down, cool down until your heart gets back to a resting speed. All right, we are going to come back and talk about some of the physics of how our capillaries function. So I will see you in our next video. Bye.